Hello, Dr. Bill-Mangosteen here, chiropractor, osteopath, naturopath. Welcome to this edition of our video newsletter. Today I'm going to talk to you about mangosteen. I've been using mangosteen in my practice for quite a long time now for various things. I've also read a lot of results about what mangosteen has done for other patients in other doctors' practices, and interestingly mangosteen seems to have a broad range of application, and probably the reason for that is, in my view, mangosteen is very powerful at controlling inflammation in the body, and research has shown that almost all problems originate with some type of inflammation. That's the latest research. So that gives us a clue as to why mangosteen has such a broad range effect and why it can help so many conditions. In my practice, I use it primarily when I feel inflammation is out of control in the body, and in particular we use it for arthritis, and this is where we get very good results in helping to reduce the inflammation and also, of course, the pain associated with arthritis. Now, as you're probably aware, that there are many products on the market, and some get good results with some patients or some people and not with others. So no product is perfect and no product gets a result for everybody. But what I've found with mangosteen is that when it comes to inflammation, it's a very useful herb or medicine to actually put into your program. Mangosteen is an Asian fruit, considered the queen of fruits, particularly in Thailand, where it's been used for probably thousands of years, and it was very highly prized. The fruit itself is quite delicious to taste, but the real medicinal value is in what they call the pericarp, which is the part just inside the shell next to the fruit. Because of what the pericarp contains, that's where a lot of the value lies. So I'm not going to go into a lot of detail in discussing that side of it. You can certainly do your own research on that should you feel inclined. The true botanical name for it is Gardenia mangostana, and there are different kinds of gardenia herbs, but this is one in particular. I did have a patient that had quite severe pancreatitis, and the doctors were quite worried about what was going to happen, and using the mangosteen regularly, he was able to control his pancreatitis quite nicely. And so he used to take it regularly and did so for a long time, and now doesn't hardly needs to take it at all, although he should be taking it to keep it in control. But every time I test him out, his pancreas seems to be working really well. So I'd recommend that anyone who has a problem with inflammation of any kind, that they consider taking mangosteen, and I find it highly valuable in my practice. Thank you.